Hello, I'm Dr. Mohit Kira, a urologist and men's health specialist. Over the years, I've had the privilege of helping thousands of men maintain not just their prostate health, but also their overall stamina, vitality, and quality of life as they age. And today, I want to talk about a very important topic, something that every man over the age of 70 needs to pay attention to: the early signs of prostate cancer. When a man crosses the age of 70, the body starts to send subtle signals that we often dismiss as just aging. But the truth is, many of these changes are connected to prostate health, and ignoring them can silently erode stamina, energy, and overall well-being. One of the most important early signs that men need to recognize is frequent urination at night. Waking up once in the middle of the night to relieve yourself is not unusual, but when it becomes 2, 3, or even more times, it's a signal your prostate may not be functioning normally. This constant disruption robs you of the deep restorative sleep your body depends on to recharge energy and hormones. Over time, this leads to chronic fatigue, weakness, and a decline in stamina during the day. Think about how important sleep is to your health. It is during deep sleep that your body repairs tissues, restores testosterone, and rebuilds energy reserves. If you are constantly being woken up by the urge to urinate, you never enter those critical stages of rest. The result is a slow, steady decline in the energy you once took for granted. Men often assume that their tiredness, lack of drive, or poor concentration is just part of getting older, when in reality, it is often linked to prostate enlargement or, in some cases, early prostate cancer. I have seen many men in my practice who come in complaining of exhaustion or a loss of stamina, only to discover that the real culprit is their prostate health. The gland sits just below the bladder, and when it enlarges or becomes diseased, it directly affects how your bladder empties. The bladder muscle has to work harder, and as a result, men experience urgency, frequency, or difficulty starting urination. These symptoms might seem minor, but they are a window into much larger health concerns. Frequent nighttime urination is more than an inconvenience. It creates a cycle of poor sleep, reduced recovery, and weakened stamina. And when stamina drops, everything else in life feels heavier. Walking becomes tiring. Workouts feel impossible, intimacy suffers, and confidence slowly erodes. Many men don't connect the dots between their urinary habits and their declining vitality, but the link is undeniable. What's most important to understand is that early detection changes everything. If frequent urination is caused by a benign condition, there are treatments to restore normal bladder function. If it is an early sign of prostate cancer, catching it at this stage dramatically increases the chances of successful treatment and recovery. Either way, listening to your body and acting early helps you preserve not only your health, but also your strength, energy, and independence. So when your body wakes you up repeatedly at night, don't brush it off as just another part of aging. See it as a signal, a warning light that deserves attention. By addressing it early, you give yourself the chance to maintain stamina, live actively, and protect your long-term health. Another critical sign that often goes unnoticed is a weak urine stream. Many men notice over time that the force of their urine isn't what it used to be. Instead of a strong, steady flow, they experience hesitancy, dribbling, or the feeling that it takes much longer to empty the bladder. Some even find themselves straining or waiting for the stream to start. While this might seem like a small inconvenience, it can actually be an early warning sign that the prostate is obstructing the flow of urine, and in some cases, it may be linked to early prostate cancer. When urine cannot flow properly, the bladder never fully empties. This puts a constant strain on the bladder muscles, which can weaken over time. The kidneys are forced to work harder as well, and this combination silently wears down the body. Men often feel drained of energy because their system is under continuous stress. In addition, the discomfort and embarrassment of having to make repeated trips to the bathroom or spending extended time trying to relieve oneself can deeply affect quality of life. A weak urine stream also has a direct impact on stamina. Think about how much physical and mental energy is lost when your body is fighting against a blockage every single day. The bladder is designed to work smoothly, but when the prostate interferes, that simple function becomes exhausting. Over weeks and months, the man begins to feel more tired, more irritable, and less capable of enjoying normal activities. And because urinary problems are sometimes dismissed as just aging, men don't always realize that something serious could be developing. I often explain to patients that a slow or weak stream is the body's way of whispering that something isn't right. It is not a symptom that should be ignored. Prostate enlargement, also known as BPH, is a very common condition in older men, but prostate cancer can also present with the same symptom. The difference between catching cancer early and finding it too late often lies in whether or not men pay attention to these small but telling signs. It's also worth noting that a weak urine stream isn't just a medical concern, it affects confidence, independence, and even intimacy. A man who struggles with urinary control may feel embarrassed or hesitant to participate in social activities. He may avoid traveling or spending long hours outside his home. Over time, this isolation chips away at his stamina, not just physically, but emotionally. By addressing a weak urine stream early, men can avoid complications like urinary tract infections, bladder stones, or kidney damage. More importantly, they can identify whether the underlying cause is benign or malignant. Early evaluation with a doctor, including simple tests, can restore peace of mind and, in many cases, restore normal function. A strong urinary flow is not just a sign of good prostate health, it is also a reflection of overall stamina and vitality. When it begins to weaken, it's time to listen carefully to your body. Acting on this symptom early can protect your energy, preserve your independence, and safeguard your health for the years ahead. One of the most alarming but often overlooked signs is the presence of blood in urine or semen. Even if it appears only once, in very small amounts, it should never be ignored. Many men brush this off as something temporary, thinking it might be from exercise, straining, or an infection that will pass. But blood appearing where it should not is the body's way of sending a loud signal that something deeper may be going on. While not every case means prostate cancer, this symptom is significant enough that it always requires medical attention. When prostate cancer begins to grow, it can disturb tiny blood vessels around the prostate and urinary tract. These fragile vessels can rupture, releasing blood into the urine or semen. Sometimes the blood is visible to the naked eye, and sometimes it is microscopic and only discovered through testing. Either way, it indicates irritation or structural changes that cannot be ignored. Unlike more subtle symptoms such as weak flow or nighttime urination, the appearance of blood is often a more direct sign that something is wrong. This symptom also has a profound psychological impact. For many men, seeing blood in semen can create fear and embarrassment. It can affect intimacy, causing anxiety about sexual performance or concerns about sharing this with a partner. Over time, this stress alone can weaken stamina, drain energy, and reduce quality of life. The mind and body are deeply connected. When a man feels uncertain or fearful about his health, his confidence and vitality drop quickly. Blood in urine can also make men reluctant to stay active. For example, they may avoid exercise, fearing that physical activity will make the condition worse. They may cut back on social activities out of embarrassment, thinking others might notice frequent bathroom visits. These subtle lifestyle changes slowly erode stamina, not because of aging, but because of worry and inactivity. In my practice, I've seen men who delayed coming in because they thought the blood was a one-time occurrence, only to later discover advanced prostate disease. On the other hand, I've also seen men who came in promptly at the very first sign and caught a serious condition early, leading to much better outcomes. The difference lies in awareness and action. It's important to understand that while prostate cancer is one possible cause, blood in urine or semen can also signal other conditions such as infections, kidney stones, or inflammation. That is why medical evaluation is crucial. Only with proper tests can we determine whether the cause is minor and treatable or something requiring immediate attention. The key message is this: never dismiss blood where it doesn't belong. Treat it as a warning, not a coincidence. Early evaluation can make the difference between a simple treatment and a life-threatening diagnosis. And by acting early, men not only protect their health, but also preserve the stamina, energy, and independence that allows them to live fully beyond the age of 70. Would you like me to now expand the fourth keynote in the same tone so the full script flows seamlessly? Another warning sign that deserves attention is erectile dysfunction, or a sudden decline in stamina during intimacy. Many men in their 70s assume that difficulties with erections or loss of sexual performance are just part of natural aging. While age does bring hormonal changes, persistent erectile issues can also be linked to prostate disease, including early stages of prostate cancer. This is because the prostate gland plays a critical role in reproductive health, and when it becomes diseased, it can affect both physical function and confidence. Erections depend on a complex balance of blood flow, nerve signals, and hormone activity. The prostate sits in a very delicate area where all these systems intersect. If cancerous cells begin to grow, they can interfere with surrounding tissues, pressing on nerves and disrupting the smooth passage of blood into the penile chambers. The result is difficulty achieving or maintaining an erection, even if the man is otherwise healthy. This is why changes in sexual stamina should never be ignored or simply dismissed as old age. The effect on a man's overall stamina can be profound. Sexual health is closely tied to energy levels, confidence, and vitality. When intimacy becomes difficult, many men withdraw emotionally, lose motivation to stay physically active, and even experience symptoms of depression. This creates a vicious cycle. Low sexual stamina leads to reduced physical stamina, and declining physical stamina further weakens intimacy. For men over 70, this can be especially challenging. Many of them want to remain active, both physically and sexually, well into later life. But when they encounter erectile dysfunction, they may feel ashamed to talk about it. Some even suffer silently, fearing judgment or believing nothing can be done. In reality, this symptom can be one of the earliest clues that something is happening in the prostate, and addressing it quickly can preserve both health and quality of life. It's also important to highlight that prostate disease doesn't just impact the mechanics of erections. It can also alter hormone balance, particularly testosterone. Low testosterone contributes to reduced desire, muscle weakness, and overall fatigue. So what starts as a sexual symptom may actually be signaling a broader decline in hormonal and prostate health. In my clinical experience, men who address erectile dysfunction early not only protect their sexual health, but also uncover hidden prostate issues before they become advanced. Treatments today are far more effective than most men realize, and catching problems early makes a huge difference. The goal is not just to restore function, but to protect stamina, independence, and well-being. The message is simply: if intimacy has suddenly changed, if erections are weaker, stamina is lower, or energy is fading, it is worth getting checked. These signs may be linked to something more serious than aging alone. By recognizing them early, men give themselves the best chance to preserve their vitality, protect their health, and continue living with energy and confidence well into their 70s and beyond. Persistent pelvic or lower back pain is another warning sign that men should not ignore. Pain in this region is often written off as arthritis, muscle strain, or just the natural stiffness that comes with age. While those conditions are common, pain that lingers in the hips, thighs, or lower back can sometimes be linked to prostate cancer, especially when it does not respond to simple remedies like stretching, rest, or over-the-counter medications. The prostate sits deep in the pelvis, close to bones, muscles, and nerves. When cancer begins to spread beyond the gland, it can irritate these surrounding tissues, creating pain that feels dull, aching, or persistent. Unlike ordinary soreness from exercise, this discomfort tends to linger and slowly drain a man's stamina over time. Pain has a powerful impact on daily life. A man who once enjoyed walking, gardening, or even playing with grandchildren may find himself avoiding these activities because of ongoing discomfort. This gradual withdrawal from movement reduces muscle strength, lowers endurance, and speeds up fatigue. It creates a cycle where pain limits activity, reduced activity weakens the body, and weakness makes stamina decline even further. Over time, even simple tasks like climbing stairs or carrying groceries can feel exhausting. In addition to limiting physical stamina, chronic pelvic or back pain also takes a toll on mental energy. Living with discomfort day after day wears down patience, increases stress, and contributes to feelings of frustration or hopelessness. When the mind is burdened by constant pain, the body's ability to generate energy and vitality is also compromised. This is why unexplained pelvic or back pain deserves medical evaluation, especially in men over the age of 70. It is also important to understand that cancer-related pain in this region can sometimes signal that the disease is advancing beyond the prostate. Early stages of prostate cancer are often silent, but when pain develops in the bones or surrounding tissues, it may indicate spread. This is why ignoring pelvic or back pain can be dangerous. By the time many men seek help, the cancer has already progressed, making treatment more difficult and outcomes less favorable. At the same time, it is worth remembering that not all pelvic or back pain is caused by cancer. Conditions such as sciatica, osteoporosis, or joint problems are also common in elderly men. But the only way to know for sure is through proper medical testing. A doctor can rule out benign causes and determine whether the prostate is involved. That knowledge alone provides peace of mind and helps men take the right steps forward. The key is not to minimize persistent discomfort. Pain is not just a nuisance. It is the body's signal that something needs attention. Men who act early often discover treatable causes and prevent serious complications. By addressing pelvic or back pain promptly, men not only protect themselves from potential prostate cancer, but also preserve their stamina, mobility, and independence for the years ahead. Another sign that deserves serious attention is difficulty holding urine or experiencing sudden urgency. Many men over 70 assume that occasional leaks or an urgent need to find a bathroom quickly are just natural parts of aging. While age does play a role in bladder control, sudden or worsening incontinence can also be connected to prostate problems, including early prostate cancer. The prostate gland surrounds the urethra, the tube that carries urine out of the body. When the prostate grows abnormally, whether from benign enlargement or malignant changes, it can interfere with the bladder's ability to hold and release urine smoothly. This disruption shows up as urgency, leaks, or difficulty controlling the bladder. For many men, this symptom is not only physically uncomfortable, but also emotionally distressing. The fear of accidents or leaks can lead to embarrassment and avoidance of social gatherings. Some men stop traveling long distances or even limit their time outside the home because they worry about access to a restroom. Over time, this lifestyle adjustment chips away at independence and confidence, which are essential for maintaining stamina and quality of life in the later years. The bladder itself is a muscle that relies on coordinated signals to function properly. When the prostate obstructs or irritates the bladder, it is forced to contract more frequently and with greater urgency. This constant strain eventually weakens bladder control, making accidents more likely. The frustration of dealing with leakage, the inconvenience of wearing protective pads, or the stress of planning daily activities around bathroom breaks all create added mental fatigue. And when mental energy is depleted, physical stamina suffers as well. I've seen many men hesitate to bring up these issues because they feel embarrassed. But it's important to understand that urinary control problems can be an early sign of something much more serious. While benign prostatic hyperplasia is a common cause, prostate cancer must always be ruled out, especially if the symptom appears suddenly or worsens rapidly. Ignoring these changes not only risks progression of disease, but also diminishes daily energy and vitality. Loss of bladder control can also interfere with sleep. Waking up frequently with urgency or leaks breaks the body's natural rest cycle, leaving men feeling tired during the day. Poor sleep reduces testosterone production, weakens muscle strength, and lowers motivation for physical activity. This combination directly undermines stamina, making men feel older and weaker than they truly are. Addressing urinary urgency or incontinence early can restore not just physical comfort but also emotional well-being. With proper evaluation, treatments can relieve the pressure on the bladder, improve control, and identify whether prostate disease is at the root. By taking action at the first sign of difficulty holding urine, men can protect their prostate health, maintain dignity, and preserve the stamina that allows them to remain active, confident, and engaged well into their 70s and beyond.